Good morning, namaskar, and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals every Sunday 11 to 12 live. You must be watching this on YouTube, Facebook, and social media like Instagram as well. But if you want to ask a question, you're most welcome. Please go ahead and type a question in the YouTube chat box only so that I can place this question before the expert and we'll get an answer for you. Also, on this show, we do give away gift vouchers and discount vouchers towards the end of the show. Be with us, and also there's a chance that you can win prizes from Apollo 24/7. There's a health quiz coming up. I ask you three simple questions and you can participate, win health credits and gifts from Apollo 24/7. तो चलिए आज का टॉपिक हम बात कर लेते हैं माइग्रेन रिलीफ. माइग्रेन एक ऐसा सरदर्द है जो जो लोग गुजरते हैं उन्हीं को समझ में आता है क्या बाधा होती है. तो ये माइग्रेन रिलीफ में क्या कर सकते हैं, क्या नहीं करना चाहिए, व्हाट वर्क्स एंड व्हाट डजंट. Let's talk about all the things that can help you to relieve migraine headaches. And today we are going to have a neurologist from Apollo Hospitals, Kolkata, and Dr. Kishalaya Karan is going to join us very shortly. He is a member of Indian Academy of Neurology, Indian Epilepsy Association as well. And Dr. Saab ka experience hai more than 10 years. He can be consulted for epilepsy, dementia, movement disorder, chronic pain and headache, including migraine and vertigo as well. तो चलिए डॉक्टर किशलया करन से मिलते हैं. गुड मॉर्निंग सर, नमस्कार एंड वेलकम टू द शो.
Namaskar. Namaskar.
Yes, doctor, thank you so much. You're joining from West Bengal, Kolkata. I'm joining from Hyderabad, Telangana. So I speak Telugu as well. Our audience are from the entire country. सबका एक ही क्वेश्चन है माइग्रेन के बारे में. आज जब हमने ये टॉपिक अनाउंस किया था डॉक्टर किशलया, इतना सारा रिस्पॉन्स आया है दैट वी आर ओवरवेल्म्ड विद द रिस्पॉन्सेज कि इतने सारे प्री रजिस्टर्ड आए हैं. नाउ आई वांट टू सी व्हाट काइंड ऑफ क्वेश्चंस कम अप ऑन द लाइव चैट एज वेल. सो लेट मी अंडरस्टैंड कि पहले ये हेडेक होता है तो नॉर्मल हेडेक से माइग्रेन हेडेक क्या डिफरेंट होता है?
Yes, first of all, good morning, everybody. Actually, this is just true story for us also. As if we do the outpatient department OPD, if 10 per patient come to us, at about 6 to 7 commonly suffer with migraine. So this is so prevalent. Approximately 3 out of 3 women, 1 woman used to suffer from migraine. Out of 5 male person, 1 used to suffer from migraine or headache.
Oh,
So if we categorize the headache, we should divide headache into 2 category. One is the primary headache, one is the secondary headache. Primary headache it is due to the inherent nerve problem of the brain, and secondary means something other causes that will create the headache. So we should first differentiate between the primary headache and the secondary headache. Among the primary headache, 3 common type of headache is there. One is the migraine, second is the tension type headache, TTH, another is the autonomic trigeminal autonomic cephalgia spectrum disorder or cluster headache type disorder. This is very rare headache. Commonly we face migraine. So first, migraine is a headache disorder. Among the headache is the primary headache disorder, and women are more habitual sufferer than the male in migraine actually. So migraine is very common. Migraine is very common disease. We used to face several patients in our OPD, daily OPD, the migraine.
राइट. तो जैसे आपने बताया कि ये प्राइमरी या सेकेंडरी है या माइग्रेन है या नॉर्मल हेडेक है या टेंशन हेडेक है, क्लस्टर हेडेक है, इन्हें कौन डिफरेंशिएट कर पाएगा? अगर किसी को माइग्रेन की तरह प्रॉब्लम हो रही है तो किसे कंसल्ट करना चाहिए पहले?
First of all, headache should be actually, when a person suffer from headache, he or she should consult the neurologist actually. First of all, we should clinically differentiate between the primary headache and the secondary headache. There are several red flag signs that can actually denotes that probably patient is not suffering from primary headache, it is a secondary headache. As for example, if headache associated with any focal neurodeficit or any limb weakness, paralysis. Suppose a person suffering from headache for a long time, suddenly he had intense headache along with the suppose left-sided weakness or the right-sided weakness, then it is probably not the migraine, probably some other diseases there. We should rule out the stroke first. Few varieties are there in migraine, present with the headache with weakness or the hemiparesis. Those are rare variety. It's called the hemiplegic migraine. But we should first
So,
rule out the common entities
right,
first. We should first do the brain image or either CT or the MRI according to the availability and according to the affordability. But as such, first thing is we should rule out the secondary headache. Secondary headache are more dangerous. Suppose headache with
right, doctor.
fever, headache with altered sensorium. We should always rule out the intercerebral infective pathology, just like meningitis, cerebral abscess, like things. Headache. Some patients even suffer from eye problem, just like glaucoma. They present with headache. We should always check for the vision issues also. Sometimes toothache may present with headache.
Absolutely.
Sometimes sinusitis or the mucosal sinusitis may present with headache. We should rule out
ये जो
those secondary things first.
राइट प्रॉब्लम जो भी है,
Yes.
जो बड़े भाषा में जो सामान्य लोगों को, people might not understand the larger terms, so there are problems which can be arising because of a primary concern, or that should be ruled
Hmm.
out by a neurologist, and that he is the best person to tell you if that headache is a dangerous one or not. तो डॉक्टर, माइग्रेन आपने, यू ऑल्सो हैव एस्टेब्लिश कि आपके ओपी में भी इतने सारे लोग आते हैं जो सफर करते हैं. This I've understood in my, in my family and friends as well, that people suffer from a very very long duration and this is a recurrent problem. तो क्यों होता है ऐसे? इसका permanently क्योर नहीं होता है क्या?
First of all, I must say that whatever the statistics I am just sharing with you, it is the tip of the iceberg. Many persons, particularly the older populations, they used to think that it is due to the gas or acidity. So my migraine is or headache is due to the acidity or gas. Many times, actually,
हाँ.
the empty stomach, poor sleep, anxiety, stress precipitate headache. So they think that it is due to the stress, due to the anxiety, it is due to the acidity. So they are suffering from headache. Many times they are not. They are actually reluctant or they are not probably aware to whom they should consult or when or to what extent they should consult a doctor. Many times people are ignorant. They used to suffer from the long time the migraine or headache, so they never come to the OPD. But why they should consult the doctors actually? First of all, to differentiate between the primary and the secondary. Many times the brain tumor missed. If brain tumor is patient suffering from the brain tumor for long duration on and off headache, suddenly tumor actually condition deteriorate, then they attend the outdoor. That should not be done actually. The clinical diagnosis is the first. Medical attention and medical help should be the first thing to differentiate with the primary and secondary. Another thing is that due to the headache, what is the problem of the headache? Headache actually decreases the quality of life. It hampers the quality of
Absolutely.
life. Productive life will be hampered. Suppose the person, whether particular lady, whether she is housewife or she is working, it does not matter. When she suffers from headache, actually it hampers her day-to-day life activities. So that's important. So we should first give some relief to the patient so she can do her day-to-day life activities in proper ways and in dignified ways. So that's why medical
Okay.
attention and medical suggestion is needed.
One question here, doctor. जैसे आपने बताया कि men and women में women are more prone to get or monthly cycles में भी होता है. A lot of people are asking, do young children also get migraine type of headaches? 8-year-old boy. This is a registered user's question. Do children also get migraine, doctor?
Yes, many times we have to face this type of problem also. And the one interesting point is that sometimes the young baby and the little child may not present with headache also. Sometimes they may present with cyclical vomiting, cyclical pain abdomen. Many times it's misdiagnosed as acidity, many times it's misdiagnosed as gastritis, but actually it is a
Correct.
migraine. So in one word, the young child, baby, when sometimes come to our chamber or the OPD, we first take the family history. If the family history
Okay.
is positive, any of the one of the parents is suffering from migraine, this baby is those type of babies are more prone to develop the migraine actually. And many times the
Re-
classical headache pattern, actually what is the classical headache pattern for migraine? It is the hemicranial headache, unilateral headache, headache associated with nausea and vomiting. There is photophobia. Phonophobia means when they exposed to sunlight, when they exposed to light or the heavy sound, they actually headache precipitates, and it is unilateral as I already told you. And
One
those
side.
are the classical features of the migraine. Sometimes they may see the flashes of light in front of their eyes. So these are the actually visual aura. So these are the classical symptoms or signs, symptoms rather. But in child, first of all, they cannot even tell their problem properly. So they only tell it is a headache. Whether it is a unilateral, is a bilateral, it is a frontal headache or the headache arising from the backside, they can properly
वो
describe, or
बता
they
नहीं
can
पाए.
rather they can properly clarify. And another thing is that the pain abdomen, vomiting, those are actually the atypical migraine attack in
Right.
young populations, and
Okay.
particularly due to the too much using of the mobile phones. Actually, for the younger population of the young child, actually it precipitates the actually precipitating the migraine, particularly due to the COVID era, particularly during the particularly we are facing much more patients as now the classes are online. Actually, for last
Okay.
2 to 3 years, so online
So,
classes they are seeing much more
so
mobiles.
can we
So that's the
can we
thing.
classify this as a
Yes.
lifestyle disorder? बच्चे हो या बड़े हो, स्ट्रेस हो सकता है या एंजाइटी हो सकता है, ट्रिगर कुछ भी हो. Can we classify this as a lifestyle migraine to be aroused out of a lifestyle issue?
Obviously, if we check, actually, migraine, I already told you, is the tip of the iceberg. All the family members, all the persons not used to suffer from the similar intensity. Some people suffer from just little bit headache once a month, once a year, or twice or thrice a year. So they don't come to the doctor. Those are actually suffer for a larger intensity, severe intensity. They used to take the consultation. So this is
Correct,
the
correct.
story many times. And what happened when we see the patient, we always ask what is the trigger factor. One point is the trigger factor. What are the
Right.
precipitating
यहाँ पे
factor?
let me
We
tell
should
you,
first
there are
identify
a
the
lot of
precipitating
people.
factor.
Yes, Kiran Sharma is asking what triggers migraine, and also Manish Sharma has asked what triggers migraine. So, are there trigger factors that one has to identify?
Yes, yes. 100%. If being a doctor, if we don't identify the trigger factor, then we can't decrease the headache attack. First, we should identify the trigger factor. We should first take care of the trigger factor. Number one trigger factor I already discussed with you is the exposure to sunlight. And one thing I must clarify that the trigger factors is not same for every patient. This is important.
Correct,
I'm again repeating,
correct.
trigger factor is not same for every patient. Suppose you are suffering from migraine, exposure to sunlight is trigger factor for you, and heavy
Correct.
sound is a trigger factor for me. So trigger factor is different.
Oh,
But most commonly, the common trigger factor we used to come across is that number one is the exposure to sunlight, second is the exposure to
okay.
heavy sound, third is that stress and anxiety, fourth is the sleep deprivation, fifth is the empty stomach. I'm telling just one by one. It is not the chronology, or it is. I'm not telling as chronologically. Just it is just my observation. Another is the increased exposure to the screen time. What happened during the COVID era and even after the COVID era, many corporate actually institute actually what they are more interested in in-house job, na? In-house job. So
Absolutely.
now
Work
the
from home.
job duration is work from home actually. So now the job actually the duration is not the 8 hours. And now it is the 10 to 12 hours many times, particularly the IT professionals. So they used to suffer much
Absolutely.
more back pain, much more neck pain, and much more headache. Their screen time is increased so such it hampers their quality of life, their stress, their anxiety, all precipitating the migraine. Another is the stress and anxiety. Those are the common factors. One is that
Right.
weather change. It is important. Sometimes exposure to cold, exposure to sunlight, even the change of weather precipitates the migraine. Many times I used to face this type of problem. This type of problem that patient used to come to my chamber. They told me that when I exposed to the winter season, actually the winter season,
Correct.
I'm suffering
Cold
much more
season.
migraine. Cold weather, they
Correct.
are suffer from migraine. Particularly some food habit, some spicy food, some chocolates, particularly some brands of alcohol, or they actually that precipitate the migraine. Those are the actually the trigger factor, and poor
So,
sleep
sir, can
obviously.
I? Yes. So, आपने काफी सारे ट्रिगर फैक्टर्स बताए हैं. which includes from sleep deprivation, lack of a certain kind of exercise भी हो सकता है doctor, not moving much, will that also cause some kind of problem?
Uh, it may happen, but commonly no. Actually, the what you are asking, you please repeat your question.
I'm saying lack of exercise भी trigger factor हो सकता है क्या, if a person is not exercising or moving enough?
Sometimes sedentary lifestyle can precipitate. Sometimes can precipitate migraine. Whatever when patient is maintaining the sedentary lifestyle, actually he is or she is not moving, obviously she or he will look use the mobile phone, then that can precipitate the migraine.
All right. So, sir, यहाँ पर hereditary and genetical questions के बारे में दो तीन issues express कर रहा है. I'll tell you. Okay, Arun Kumar KG, इनका question है, I get migraine headache at the right side of my head only when I'm in stress. Do we get this as a due to a hereditary reason? Because my father also has a similar issue. Also, somebody is asking, is migraine genetical? It's a registered user's question. Mr. Arun Kumar has asked first question.
Actually, due to the connection error,
Okay,
please
I'll
repeat
read
the
the
question. Actually,
question
I
again.
have connection. Yes,
Shall I
yes,
read the question again?
yes. It is a connection
Yes,
problem
doctor.
is there.
Yeah. Arun Kumar ji ka question hai, he gets headache at the right side of the head only when I'm in stress. Do we get this as a hereditary reason? Because my father also has a similar problem. And also a registered
Yes.
user has put, is this genetic?
No, actually, what happens? The one variety is called the genetic migraine. Genetic migraine, we commonly don't use the genetic study actually in our day-to-day life practice. That is cumbersome, it is costly, and the treatment is same. Only the prevention and the prophylactic treatment, preventive treatment, abortive treatment. Those are the treatment options. Whether it's a genetic or the non-genetic, the treatment is same. But obviously, if there is any family history is positive, then obviously chance of getting migraine is much more in the next generation. So obviously, it is a genetic background is there.
ओके, पर अरुण जी के केस में इनको हेडेक आता है, उनके फादर को भी हेडेक आता है, सो ये हेरिडिटरी है क्या?
Yes, it is hereditary. It is hereditary.
ओके, it is done. So स्ट्रेस में इनको आता है, इस स्ट्रेस इज ट्रिगर फैक्टर.
Yes, obviously, stress is a trigger factor. Actually, stress is a trigger factor. I used to see patients that if several family members suffering from headache. The trigger factor is not different for the several family members. All the family members. Some family members, suppose the father trigger factor may be the poor sleep. For son, trigger factor may be the job-related stress. So trigger factor varies, but genetic is the same. It is a hereditary
ओके,
migraine actually.
तो सर, तो कैन आई आस्क यू, अगर ट्रिगर को कंट्रोल करें तो हम माइग्रेन को कंट्रोल कर सकते हैं?
100%, 100%. Actually, when we discussed regarding the therapy option or the treatment option for the migraine, we always first check for the trigger factor. We first identify the trigger factor and explain the patient the trigger factor and how to tackle the trigger factor. This is the most important part of the treatment option. If only controlling the trigger factor, if the 50% or 60% headache attacks subside, then the drug burden will be less for the patient. It is a common sense. If drug burden is less, then chance of drug related side effect is less. So obviously first we should give emphasis on correction of the trigger factor number one, then treatment of the migraine with pharmacological treatment. So both pharmacological and non-pharmacological treatment should be actually started
Together.
side by
Correct.
side, not one after another.
Ah, right. So, doctor, here's another question. Hema is asking, I get migraine headache in bright sunlight. So, what precautions should I take while going outside? This is something interesting, doctor. Sunlight हमें पता है कि trigger है. बाहर तो जाना ही पड़ेगा. They have to go out and work or they have to go out. So, how do we manage this? This is a tricky
Uh,
situation.
this is a this is a very typical problem actually for the Indians, as we used to face the sunlight in our daily life activities. First of all, if it is necessary, we have to go. This is the need of our life. But better to avoid the sunlight when it is not always necessary to go outside. Suppose I have to purchase something. If it is advisable, if I go to the shop in the afternoon, or rather in the evening or the early morning. Early morning shop is not open, so evening. So we can modify to some extent our day-to-day activities. But when we are forced to go outside due to our job, due to our different type of activities, in that case, we should actually protect ourselves with umbrella, number one, sunscreen or the specs. And I used to tell my patients actually always wear some topis or some dupattas, particularly the ladies actually for female patients, dupattas. They should cover the actually their head properly with specs or sunscreen or umbrellas like that.
Right. So, sunscreen, umbrella, cap, or anything that can cover your body in full, these are the precautions one has to take to go out. That's interesting, doctor. So, doctor, here's a person in motivation within you. इनका नाम age gender मुझे दिया नहीं है. They're asking, I have one side headache which starts from one eye. Can I classify it as a migraine?
Yes, actually, migraine attack actually starts from classic typical headache attack for migraine. Actually, it starts from one side, and most commonly it arises from the orbitofrontal area. Just I'm showing my eye. Orbitofrontal means this. It starts from
Oh,
this, and it spreads to the other side. And for typical migraine attack, actually, it is called the alternating hemicranial headache. Alternating hemicranial headache means one time, suppose headache starts from the right side, then it spreads to the other side, and sometimes starts from the left side, spreads to the other side. This is typical for migraine. But many times there is deviation of a classical migraine headache attack. Sometimes it starts from the orbit, starts from the back side, occipital area means back of our scalp. So it depends, but around the eye or eyeball, many times migraine patient actually suffer headache from arising from that particular area. One interesting thing is that it is for the doctor actually. Sometimes some another headache variety is called the cluster headache. That headache actually starts around the orbit area. There are several other clinical features. I'm not going through details. Actually, this is the job of the doctors. That is to differentiate between the
correct, correct.
migraine and the cluster headaches. This is the job of the doctors actually.
Correct, doctor. So classification to doctor ही करेंगे. Anybody who would want to consult Dr. Kishalaya can be. He's available on Apollo 24/7. We'll leave a link to consult so that online Apollo 24/7 में कभी भी आप उनसे appointment ले सकते हो. Doctor, while we classify and while we visit a neurologist, even before that, are there any tests that you recommend? Do you think that there are some things that one person has to keep a check on?
So you're asking for the tests for the
यस
headache.
डॉक्टर एनी यस हेडेक हो या ट्रिगर्स के लिए कोई टेस्ट हो ऐसा कोई होता है कि ये मुझे
No,
चेक
no,
करके देखना
no,
है.
no. Trigger. There is no test for triggers actually. Trigger point or trigger factor. We should ask the questions actually. It is the clinical questions only.
इट्स अ क्लिनिकल
Or
लेवल सो
regular
देयर इज नो
casual
टेस्ट.
questions, we can find out the triggers. But for the tests, as you told, first of all, clinically we should differentiate between the primary headache and the secondary headache. Then, if
राइट
doctors suspect that it is probably some secondary headache is going on, then he should do some first test is the brain image. Comparison wise, two brain images there. One is the CT scan, one is the MRI. MRI is always better than the CT. For few subtle situations, CT scan is advisable rather than the MRI. But I must tell that it is the clinical judgment and clinical call of the doctors. For all headache patients, we should not advise for CT brain and the MRI brain. It is not advisable. Suppose
या
a person is suffering from headache. I'm just giving an example. A person is suffering from headache for 10 years and he or she
या
attended my OPD. Better not to give the CT scan fast or the brain image fast. But another scenario is that a person is suffering from headache for 10 years. Suddenly, for last 2 years, he or she is suffering from extensive headache, that type of headache is the fast for his life actually. So he's some headache, just undulating headache, minimal headache, mild headache, and for 10 years, suddenly headache intensity is much more. In that case, you have to do the brain image, whether some new thing happened, yes or no.
Because
So
new
it is
development.
totally a
Yeah, correct.
clinical judgment of the
Right.
doctors. My standpoint is this is very clear. This is actually textbook recommendation for all headache. We should not do CT scan or image every time.
Right. So doctor, thanks for throwing light on the test factor. When best part is to trust your neurologist and clinical evaluation करवाओ कि ये कौन सा headache है. That's the best thing to do. So now I'm coming to a entire bunch of questions which are talking about medicines. So I'm going to read out the names and the questions, doctor. We will bunch up everything about medicines into one. So, can I avoid migraine without medication or any other natural medications or home treatment available? This is one. Then Priyankar Paul, instantly can I, is a male 35-year-old, can I relieve severe migraine headache instantly with anything other than taking medication? Here first I'm asking you about, I don't want to take medication. मुझे natural alternatives में कुछ है क्या?
First question, just better to answer the question first one by one. Your first question answer is that obviously if I treat the trigger factors, or rather if I check for the trigger factors, if I control the trigger factors, if I take care of the trigger factors or the precipitating factors, I already told you 50 to 60% headache attack severity decreases.
Right.
Lifestyle modifications. I used to tell my patient is that take food in proper time, go to bed in proper time, better avoid screen time for a long time, better avoid mobile using mobile phone for a long time. If we maintain a healthy life in a day-to-day life, healthy life, then obviously it will make a difference. Without medicine, you can check your headache to some extent, or rather than a large extent. Another important thing
So,
is that meditation and
yeah.
the yoga,
So,
those are the two factors,
yoga.
yoga and meditations, actually they will keep your mind refreshed, they will decrease the headache attack. It is actually observed, it is a fact. So healthy lifestyle, meditation, yoga, take plenty of water, avoid screen time, that make a difference, that will obviously decrease your headache attack.
Wonderful, doctor. Wonderful
but
advice.
but but
So,
but
here Neha
but
Sud is
but
asking, sorry, doctor,
huh,
one quick addition to the thing. Neha Sud is asking,
huh.
what if I'm having an attack and if I want immediate relief? Can I take any medicine?
It is not possible actually. Probably our question is the acute headache attack without medicines. You want to take the relief, no?
No,
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 no, no.
no.
Actually,
I'm
for
having a headache. Immediately to reduce
yes,
my pain, can I take a medicine?
yes. Obviously, you should take a medicine. Obviously, you should take a medicine. So, for acute headache attack treatment, the medicine is the analgesic. So there are several analgesics. Few analgesics through oral, few analgesics nasal spray is there. But in our day-to-day life practice, we being a doctor, obviously, I'm telling actually it is a doctor. First of all, it is a physician's call, neurologist call. What medicines or what analgesic he is comfortable or she is comfortable. I'm talking regarding the neurologist or the physicians. But my my opinion is that better to start with a simple medicine that side effect profile is less. Why? Many medicines are there which is much more powerful, side effect profile is much more. As if we do or if we use those medicines for a long time, that may create the liver issues, kidney issues, and gastric issues. So, simple analgesics should be tried first. And another thing is that better to avoid, rather to avoid, must avoid over the counter medications. Many times people
Right.
used to take the over the counter medication in India. This is a very unfortunate thing. Over the counter medications means people rampantly go to the physician, or not to the physician shop,
The
physician's
pharmacist,
chamber,
you buy
to the
it
shop.
on the counter.
So that's what problem. What is the sequel? Every time they are taking the analgesic tablet without any prophylactic treatment, and that will create another health hazards, and that will create another entity. It's called the medication overuse headache. Means after taking the analgesic for a long time, patient's headache is shifted to the chronic resistant migraine, drug resistant migraine, and that type of migraine is very difficult to treat. So, a simple
Right.
analgesics in adequate dose. And one thing I must say that these analgesics should be taken within 5 minutes of 5 to 7 minutes of headache onset. This is much more important. Many times,
Oh,
people used to take the medicines after 30 minutes, 40 minutes when headache is not controlled. But when the chemical cascade, actually, there's nothing but a chemical reactions na, within the scalp or the
okay.
brain, there's some chemical reactions is going on. That's I'm talking very non-medical fashion. It is a chemical reactions. So if I use the abortive treatment or the acute treatment after 30 to 40 minutes, when the chemical reactions or the chemical cascades or the all the pathology process started, then it will not provide any relief. So
So,
we have to take the
so
medicines
according
as soon
to
as
Dr.
possible.
Kishalaya, you have to take a medicine which is a simple painkiller, if your doctor prescribed, that is not from the over counter pharmacy से आप लाइए मत. Headache ప్రారంభంలోనే, I'll just do it in Telugu because this is an important feature as well. హెడేక్ మొదలైన ఒక 10-15 నిమిషాల లోపలే మీరు లేదా 7-8 నిమిషాల లోపలే ఒక సింపుల్ పెయిన్ కిల్లర్ వేసుకుంటే కనుక అది ఉపయోగపడుతుంది. 30 నిమిషాలు 40 నిమిషాలు దాటిన తర్వాత వేసుకుంటే పెద్దగా ఉపయోగం లేదు అని డాక్టర్ గారు చెప్పారు. వుడ్ యూ వాంట్ టు డూ దట్ ఇన్ బెంగాలీ as well, డాక్టర్?
বেঙ্গলি আচ্ছা মানে
Yeah.
আমি যেটা আই এম টকিং ইন বেঙ্গলি অ্যাকচুয়ালি নাও সো মাথা ব্যথা হলে যখনই মাথা ব্যথা শুরু হবে একটা সাইড থেকে ধরুন টিস 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 করে এখান থেকে মাথা ব্যথা হচ্ছে বা এখান থেকে মাথা ব্যথা হচ্ছে, যখনই মাথা ব্যথা হবে মাথা ব্যথা শুরু হওয়ার 5 মিনিটের মধ্যে 5 থেকে 7 মিনিটের মধ্যে মেডিসিনটা খেতে হবে। তারপরে কিছু খাবার খেয়ে নেবে বা অন্য কিছু খাবে, কিন্তু মাথা ব্যথা শুরু হওয়ার 30 মিনিট কি 40 মিনিট পরে খেলে ভালো কাজ দেবে না।
Right. Thank you so much, Doctor. I hope our participants from West Bengal will understand this better. Right, sir. Here's Joseph Raja Pillai. He's 60-year-old. Had visual auras with mild headache about twice a week. I don't think this is a migraine related issue, but still I'm reading it out in case quick answer अगर देते हो तो उनको वो tablets दिया गया है Lonazep 0.25 Decorate ER. Now the occurrence is very rare. I didn't get the question, sir, but is this a migraine related question?
Obviously, twice a week headache and visual aura is likely the migraine. Visual aura is likely the migraine. So he should always in touch with a local neurologist,
Neuro.
obviously, as age is 64 years. So obviously for him, all the drugs is not advisable. Huh? So there
Right.
obviously may be some liver issues, may be some diabetic or hypertensive issues. Though
Correct.
drugs should be taken very cautiously for him.
So yeah, with caution, and once you're, sir, I want to understand कि एक बार आपको आपके न्यूरोलॉजिस्ट या फिजिशियन ने एक मेडिकेशन पे डाला है, and how long do you have to continue this prescription medication, and what's the period of a treatment कि occurrence कम हो गया है या ये repeated कम हो गया है, कैसे पता चलेगा हमें?
This is a very good question and relevant question actually. First of all, migraine, just to summarize, actually, the migraine treatment is three part. One is non-pharmacological treatments, treat or check the trigger factors. Second part is the abortive treatment of the acute headache. Acute headache, it is treatment is the analgesics. A, B, C, D, X, Y, Z, whatever the analgesic doctor should prefer. It is the abortive treatment. It is treatment with
Right.
analgesic. It is for acute migraine attack. Most
Right.
important part is the to prevent the attack. It is called the preventive medicine. It is called the prophylactic medicines. These medicines is
Right.
not the painkiller. So there are several number of medicines at present in India. And what are the duration of the treatment? Actually, first, you can actually treatment policy is very simple and very logical. First, we should start one medicine. If it is not controlled, then add second medicine in optimum dose. First of all, we should use the medicine to optimum dose.
Dose.
And the choosing of
Absolutely.
the medicine, or when the points why we are using or choosing this, not choosing those medicines, or we are choosing why A not X, not Z. It depends on the patient's age, patient sex category. Suppose patient is a female person, or planning for pregnancy, the treatment policy will be changed. Old patient, 60 years old, liver disease, one treatment policy. So treatment policy depends on the patient's condition, patient's comorbidities, patient's other clinical conditions. So we should use the drug very categorically, as we have to use this drug for a long time.
Right.
Classical situation, actually 2 to 6 years, sorry, 2 to 6 months treatment is must. 2 to 6 months treatment is must. Many times we see the patients actually used to take the medicine for 1 to 2 months, 1 to 2 months, and suddenly stop the treatment. Again, he
हाँ.
will end up with another migraine attack. So he should stick to the treatment, to a particular doctor, to the treatment at least 2 to 6 months. When doctor is comfortable, then drugs should be gradually it should be omitted, or it should be tapering down. But
Correct.
if headache attack again is severe, then we should reintroduce another drug. We have to replace one drug with the other. And we should always maintain a headache diary. I used to tell my patients that maintain a headache diary. Suppose January you are 4 headache attack, February you are 10 headache attack, so your headache is increasing. So maintenance of the headache diary is must. In OPD, VC OPD, many times patient may not tell that how what are the intention, or what are the number of days he or she used to suffer from headache. So he or she should percolate a clear message. Doctor, this month I have 4 headache attacks. Previous month I have 15 headache attacks. So obviously 15 to 4. So obviously patient is in a good position. And when headache attack is 1 to 2, rather 1 to 2 or 2 to 3 per month, so obviously it is the time that we can decrease the prophylactic medicine dose gradually.
राइट सो बहुत ही इंपॉर्टेंट पॉइंट डॉक्टर किशोलय ने बताया है कि आप अगर आपके न्यूरोलॉजिस्ट या आपके फिजिशियन की कंसल्टेंसी के बाद मेडिकेशन शुरू करते हो तो उसको 1 महीने में या 2 महीने में बंद मत कीजिएगा. गिव इट टाइम सो दैट द डॉक्टर कैन एनालाइज इफ द डोज इज वर्किंग ऑन यू. वो जो ऑप्टिमल डोज आपके लिए है या नहीं है, आपके एपिसोड्स कितने आ रहे हैं, वो एक डायरी मेंटेन कीजिएगा कि दैट विल हेल्प यू टू अंडरस्टैंड what kind of help your medication is doing. And जो मेडिकेशन है वो इमीडिएटली आप विड्रॉ भी मत कीजिएगा, डॉक्टर साहब से पूछ के आराम से विड्रॉ कीजिएगा. दैट्स व्हाट डॉक्टर किशोला हैज मेंशन्ड. सो क्विकली वो मैंने हिंदी में भी ट्रांसलेट कर दिया फॉर पीपल टू अंडरस्टैंड इन ऑल लैंग्वेजेस. Next question that I want to understand is, there's a person who has all the trigger factors. Can one have multiple trigger factors? Sano Ilam, unka question hai, I get headache in the back side and the left side of the head, and often this is after sun exposure, lack of sleep, or I don't have meals on time, but I do not have vomiting sensation, but headache lasts for 2 days.
So I think so all the trigger factors should be taken care of by the patient, and the doctor
So
should
one
guide
person can have
how to tackle.
all the trigger factors.
Yes, proper
Oh,
meal, proper sleep. I already told you, na, proper meal, proper trigger factors should be
correct,
taken
correct.
care of.
So I was
Without,
thinking one person will have only one or two trigger factors, but anything
no, no,
can
no,
be a trigger factor.
many person. Yes, yes, it happens. Those unfortunate patients
Oh,
actually, or other unfortunate person may have the several trigger factors. So it is very
I'm
difficult
sorry.
to treat migraine. So those patients actually it is very difficult to treat always. So in that case, actually the proper drug selection should be very particular, and very particular drug selection should be actually done.
Okay, okay.
And
So
I think this patient
Sanuji,
needs
I
two
think
to three prophylactic treatment.
right. तो सानुजी आपका simple नहीं है. You must be evaluated immediately so that you can be put on a treatment. Dr. Kishala advises that there should be a treatment plan for you. We will leave a link below to consult him if you wish to do so. Sir, can this be a trigger factor? Neha Sood पूछ रहा है, If I get migraines if I do not wash my hair. I need to wash my hair every day. Is there an alternative that I can follow?
Obviously, there is no alternative. Uh, so, what is the problem if she wash hair every day?
हाँ वो सर कभी कभी काम में रहते हैं तो काम बाल वॉश करके काम के लिए भागना मुश्किल भी हो जाता है सो इट इज एट टाइम्स डिफिकल्ट
So, another thing is that the same thing I'm repeating. Actually, the proper lifestyle, proper healthy lifestyle is necessary. Actually, okay,
राइट
taking care of your hairs. Actually, it is necessary.
राइट सो लाइफस्टाइल फैक्टर्स आप पहले कंट्रोल कीजिए उसके बाद में ये भी ट्राई कीजिए कि डू कंसल्ट अ डॉक्टर सो दैट देयर माइट बी सम प्रोफिलैक्टिक ट्रीटमेंट अवेलेबल फॉर यू एज वेल सून डन सर नेक्स्ट क्वेश्चन इज रुमाना
Yes.
20-year-old female suffers from one side headache with throat pain blocked nostril pain in half face including ear is this migraine
No, we should rule out the cluster headache also for this particular lady. Though cluster headaches used to happen in male persons in a middle-aged male, but as there is a blocked nose or the throat pain, so we should rule out the cluster headache also. Many times,
right
actually, cluster headache and the migraine there is an overlap. It is called the overlap headache. So we
right
should treat the both entities the same time. So better to check the patients whether there is some another headache entities there, yes or no. So we should check.
right
So it is not
so
a typical migraine. Some atypical variants are there also.
Okay, okay. So next question is also something similar. देबाशिश नंदा सुभश्री जी के लिए पूछ रहे हैं 50-year-old female के लिए. I get headache which starts due to sensation inside the nose and spreads to the head and then lasts for 2 or 3 days. Is this also a kind of migraine, doctor?
It is a migraine. It is a
Oh,
migraine.
it can start in the nose as well.
Yes, yes, yes. Unilateral.
Okay. Right. So here's an interesting question, Doctor. Swati Srivastava is asking this question. I've heard that migraine headache goes away after a certain age. Is this true? And if that's so, how many years do I need to wait? What age does it go away?
It is a very good question and good observation. Is that uh, first of all we should differentiate male versus female. Many times we used
Okay.
to see that female person after the menopause, the severity or the intensity of the headache attacks subsides, decreases. It depends actually.
Uh,
And even we used to see that patient, suppose her mother used to suffer from migraine. If the mother had history of decreased headache attack or headache frequency after menopause, the next generation may follow the same rule. And second is that sometimes even after menopause, few unfortunate ladies used to suffer from migraine with the same intensity. We used to see those patients also. So it depends on the patient to patient, varies from patient to patient. And
right.
adult male thing is similar. Here, gradually over the times, over the years, there is severity of the migraine attack actually decreases. It is gradually, but for the female after menopause, obviously there's much more reduction of the migraine headache attack or headache days sharply after the menopause, and
Right.
it's
Right.
you used to see many patients.
Okay, okay. So, doctor, while we are talking about female menstrual cycle, menopause, and other fertile period, में जो बात कर रहे हैं, here are two questions related. Isha Gupta, 37-year-old female, migraine increases before or after my menstrual cycle. Can I do something about it? And also same question,
It is a
similar
very
question, Jyoti female, same during period time and when I wash my hair, I take paracetamol, it generally subsides, but this is a continuous process.
Yes, I already told that for when I am discussing the trigger factors, I already discussed the stress. But at that
Correct.
time, I have not actually clarified what type of stress. Now I am clarifying.
Oh, okay,
Stress may
doctor.
be different. Not only the examination related stress, job related stress, physical stress should be divided in two parts. First of all, stress, precipitated migraine. It is a well-known entity. Second part, stress should be divided two parts: physical stress, mental stress by emotional stress. Mental stress, emotional stress may be job related, maybe psychological, maybe some examination phobia. Those are the mental or emotional stress. Physical stress, different types. One is the uh, suppose surgery. Surgery is a physical stress. So after surgery, sometimes migraine attack precipitates or migraine aggravates. And one second physical stress is the menstruation. It's true, it is an observed truth that after the menstruation, headache severity actually increases. In that case, she used to take the simple analgesics one day prior to the presumed menstruations when menstruation cycle is regular. But when menstruation cycle is irregular, in that case, on the first day, she should take the analgesic tablets. If
Acha.
without menstruation, menstrual cycle or menstruation without the if other than the menstrual days, if there is no headache, better not to take any long-term medicine. If you take the simple paracetamol or any other simple medicine uh, on the day zero or the day one or the one day of your menstrual cycle, that is obviously good. Better not to take the medicine for a long time or the throughout
Oh,
the month. So obviously,
right.
menstruation is a stress factor
All
for
right.
some
So,
patients, not all patients.
for some people, not for everybody. So, for some people who
Yes,
have
yes.
menstruation या monthly period, अगर आपका stress factor है और वो trigger करता है migraine, then better to start with a simple painkiller analgesic on the day zero. अगर आपका cycle सही नहीं है, or at least once the cycle starts. In case relief नहीं मिल रहा है, then go ahead consult a neurologist and maintain a plan. So, female who is pregnant, Safana Yasmin, 25, is it okay to take medicines for migraine during pregnancy?
This is a good question. Actually, the migraine and pregnancy, it is actually a big chapter. That should be actually properly taken care of by the neurologist and also by the gynecologist also, the gynecologist and
Oh,
obstetricians.
right,
Actually, what
right.
is the fact? What is the observed fact is that it is the thumb rule of one third rule. One third of the migraine patients during pregnancy headache attack decreases. One third headache attack is same. One third headache attack increases. It is due to the hormonal imbalance. So one
Okay.
third patients sometimes one third patients during the pregnancy period there is less headache attack. Those are the actually lucky lucky or the happier group. And 50 another one third intensity is the same, and the rest there is severe headache during the pregnancy, but after the pregnancy or after the delivery, the headache frequency or headache attack as just like before. The what is the problem for us actually? The pregnancy, there is three trimester: first trimester, second trimester, third trimester. Means first 3 months, middle three, and last three. Initial 3 months, actually it is the time for organogenesis. Means in this first 3 months, or rather first 2 months, organs are actually in the developing phase. In that time, better not to take any regular medicines. Those can cause the teratogenicity. Means those can potentially to cause the fetal side effect or fetal organ defect.
Correct.
Unfortunately, many of the drugs we used to give patients as a prophylactic medicines that are potentially teratogenic, means potentially that can harm the baby structurally.
Okay.
So the problem is that, in that case there is no real life data. No, you can test the drug efficacy in a pregnant person. Actually, the ethical
Correct.
committee or ethics committee will not give the permission. So all the many studies are done on the subhuman species, actually guinea pig or blah blah blah. So in that case, being a doctor, we actually think twice or thrice prior to start any prophylactic treatment in pregnant women, particularly in the first trimester. Later on, later on, obviously some liberties there for us, but the initial stage we use only the simple paracetamol tablet that is potentially there is no harm it is no harm for the mother and the baby. So we should restrict on the treatment for the abortive treatment, means the treatment
Yeah.
of the acute headache attack. But the long-term treatment or the prophylactic treatment in initial days, we should be very much cautious.
So pregnancy and migraine is a indeed, as you said, huge chapter. कभी एक दिन पूरा उसी के बारे में हम बात कर सकते हैं. That's a huge
Sure.
topic. Yes, it is impacting a life again. So one should be cautious in taking
And
medication.
and and my opinion is that if if we discuss this topic better, neurologist and the gynecologist should be side by side
Absolutely, doctor. You're
in the
right.
same
So, sir,
same platform,
yeah,
same
it
platform.
is not simple. Yeah. And secondly, now understanding the complications of unattended migraine. अगर ये मैं कुछ नहीं करती हूँ, सालों साल ये चलते रहता है, with other than affecting the quality of life, is there a risk to life or any complications? Manish Sharma is asking, will this lead to epilepsy?
No, actually, migraine. Actually, there is a term is called the migralepsy. Migraine patients sometimes suffer from the epilepsy, and epilepsy patients sometimes suffer from the headache. This is not migraine. So these the overlapping areas are there, but not all the migraine patients actually land up with epilepsy. It is not the fact. It is a spectrum of disorders. Some patients may suffer from both migraine and the epilepsy. One good thing is that few drugs are there, prophylactic medicine. I'm actually not mentioning any drugs name here, and it's not the platform to mention any drugs name or to for as a prescription, either written
We
or the
appreciate.
verbal. So few drugs are there which act both for migraine and both for epilepsy. This is the good thing. In those particular group who is suffering from migraine and epilepsy, we use two drugs. The two drugs are there. I'm not mentioning again the name here. Two drugs are there that is effective both for migraine and epilepsy. But all epilepsy patients and all migraine patients actually don't never land up to the migraine, to the epilepsy actually.
ठीक है. Sir, so as you were talking
And and
about
and,
cluster,
and Another
yeah, yes,
another point actually, just probably I should
like
tell
get
much
you.
more regarding the pregnancy and the migraine. Most important thing there's some, unfortunately there is some little bit complication happen in pregnancy. I'm telling that the stroke, venous sinus thrombosis, stroke, venous sinus thrombosis means the blood clot within the veins of the brain. Within the brain there is some venous system, blood clot happened and rupture of the venous system is there. It's called the venous sinus thrombosis. Venous sinus thrombosis, bleeding, stroke, sometimes some pituitary tumor actually swollen up during pregnancy period. Those patients present with headache, so we must be very much cautious. Rather, gynecologist and the neurologist will should watch side by side, as most of the time they use pregnant patient, the pregnant mother used to visit gynecologist much more. So gynecologist should be very much cautious whether this patient is suffering from the migraine aggravation versus secondary headache. As I already mentioned, it is very difficult. Sometimes it is missed. Suppose the patient, non-patient of migraine, she may think that it is nothing but the aggravation of the migraine. So
Right.
later on, she may develop complicated, some complications, brain-related complications. That I already told you, some brain-related secondary headache. So that should be taken care by the gynecologist, the neurologist side by side. So we should not miss
Okay.
those entities. Otherwise, it will be
All right.
life-threatening for the
So
both the mothers
quickly,
and the baby.
yes, doctor. Important.
Yes.
तो so खानों को आपने बताया कि we need to differentiate if it is a cluster, it could be any other headache other than migraine. And now she's asking, how do we differentiate between a tension headache or a cluster headache or a migraine? I think it's not a platform to discuss this, but who and correct kind of validation कहाँ से मिलेगा?
Obviously, it is the doctor's job. As I'm telling, that the tension type headache actually is the dull headache. It throughout the scalp areas. There is no unilateral preponderance. Means it's a holocranial. Throughout the scalp there will be headache, and there is no associated nausea and vomiting, no associated photophobia or phonophobia. There is no such trigger factor for the tension type headache except the stress and anxiety. So these are the
Okay.
dull, non-specific headache throughout the day. It's most likely tension type headache. And for the cluster headache, it is also unilateral headache to start with. Several varieties
Okay.
are there. clusters, trigeminal autonomic cephalogens are there. It is actually pulsatile. Sometimes, many times, there is a watering from the one side of the eyes, or some nasal blockages there. So those are actually the cluster variety of headache.
Yeah, quickly, Doctor, two questions that I would want to take and conclude the session. Quick answers, please. Gurudeep is asking, magnesium
Yes.
pills, can they be helpful in treating migraine?
Yes, magnesium pill is helpful, but not a large scale. You have to give another medicine also. Several pharma companies actually are introducing the magnesium containing tablets. I'm not telling the generic or telling the brand name. Actually, those are helpful, but those are the as a add-on for prophylactic treatment. If only the migraine, only the magnesium containing pill can't help the migraine. Actually, I think it's not so easy.
Okay. Right. So, Bani Prakash ji, we did talk about what you have what you're going through, continuous exposure of laptop and screen exposure. We have talked about it in the beginning itself. You can go back after the recording, after the live. We'll leave a recording on the channel. But here's one question who's asking, sir, when there is a high lighting environment and I have a profession where I have to sit before laptop, can I use some kind of lens or any glasses that you would suggest to help me from glare and lighting?
Not a good solution actually. Better to avoid the screen time. My suggestion is that several companies are introducing those are glasses, but I think it is not to some extent not very much helpful. To some extent helpful
Right.
maybe, but not very much helpful. Better. My suggestion is
Right.
that better if you looking at the glasses for 10 minutes. Better to take the rest and just see or look on the other side on the another side, but don't focus on the same glasses or same screen for a long time. This is my suggestion.
राइट अगर आपको काम करना ही है तो थोड़ा ब्रेक ले लीजिए फोकस शिफ्ट कीजिए मेक श्योर दैट योर कंपनी ऑल्सो प्रोवाइड्स यू सर्टन रिलीफ एक्टिविटीज बिकॉज आजकल काफी सारे एम्प्लॉयर्स भी वेलनेस पैकेजेस एंड वेलनेस फॉर एम्प्लॉयज दे आर टेकिंग केयर
Yes, yes, I can't still remember. This is actually, I'm a little bit nostalgic after hearing this question. Actually, in my earlier childhood, my teacher used to tell me that. My teacher, so when you are reading book, sometimes you look towards the trees, green trees. It is helpful for your
करेक्ट
eyes. It is at a dictum actually.
देयर
Today's
इज अ
today's
विजन
school, there is no
2020 पे
trees around.
yeah
Yes, yes.
though 20
So
minutes
looking
every
at the
20
green is
minutes
helpful.
correct. Every 20 minutes you watch something at a 20 feet distant object for 20 seconds before you return to the work. That's Vision 2020, I suppose.
Yes,
All right,
that's
doctor,
that's that's
one quick
that's important.
yeah, one last question we will we'll have to wrap up for today. So persisting migraine, chronic migraine, can that be changed into episodic migraine with help? This is Adarsh Kumar, who's 17-year-old suffering from migraines.
Obviously, proper medication and proper lifestyle and proper treatment of the triggering factor. Obviously, this is the actually job of the neurologist. Chronic migraine can be shifted to the episodic migraine, provided
Right.
patient needs to take less number of analgesic pills.
Wonderful, doctor. Thank you so much. So, with that, we come to the end of question answer section. I would now want you to condense everything and give us top tips to manage migraine and give us solutions for migraine relief.
Number number one is that always consult a neurologist or headache. Don't Second point is that don't ignore the headache. Number three point is that uh, proper lifestyle is necessary. Number four point is that other than the pharmacological, non-pharmacological treatment is the should be actually should be we should give emphasis on the non-pharmacological treatment. And last point is that when doctor is prescribing some medicine, always stick to the medicines. If there is some side effect, always consult the doctor. But don't stop the medicine yourself without consulting the doctor. And don't take the over-the-counter medications or over-the-counter analgesics. And always maintain a headache diary. So proper awareness, proper knowledge, proper treatment is essential to prevent and to treat to tackle the migraine.
Wonderful, doctor. Thank you so much for this time and patience in answering all the questions and queries from our audience. Namaskar. Have a great Sunday.
Namaskar.
Thank you, sir. And now I'm going ahead to conduct the health quiz. I'm going to ask you 3 questions, and you have to type your answers in the YouTube chat only, from where the winner's name will be announced towards the end of the show. We are just letting you all know that a winner will be selected only on the basis of a sole discretion of Apollo 24/7 team. And even if you're selected as a winner, and if the computer notices that it's the same phone number which is used to download the Apollo 24/7 app, which in case that you have changed your email ID or your phone number, the name, but the associated phone number with Apollo 24/7 app remains the same, you will not be credited with the gifts. So this is a note that we wanted to give you out to the audience who has been asking why the credits are not yet credited. If you have been using the same phone number for Apollo 24/7 and you change your name on YouTube, which you will not be able to get the gift money as well. So chaliye, winners, once I take your name, you have to write back to us at marketing@apollo247.com. Gift vouchers will be shared with you. Download Apollo 24/7 and participate in the quiz. Here's the quiz questions for today. Question number 1, fill in the blanks. To avoid migraine triggers, people should regulate their what? LI-E-TY-E. Please fill in the blanks. To avoid migraine triggers, people should regulate or monitor their dash. Question number 2, true or false? A migraine is simply a bad headache. Is that true or false? Question number 3, yes or no में answer कीजिए. Migraine triggers vary from person to person. Very simple questions. Go ahead and type your answers and make sure that you type them well together. So in the meanwhile, while I get the answers and our team selects winners, here are some gift coupons that we give away. The first one is code AskDoc150, AskDoc150. Use this code on Apollo 24/7 to get up to 150 rupees cash back on online doctor consultations, and you get to consult doctors who are top doctors from Apollo, entire Apollo hospitals across the country. And next one that we give away is code FIRST3, FIRST3. You order medicines direct from Apollo and get 25% off on online medicine orders. This is on Apollo 24/7 for the first 3 medicine orders above 1000 rupees, and you also get a 2-hour delivery too. So next one is an exclusive one that we give away for our Health Hour viewers. Use the code HH247. You get 199 off on online consultations with Apollo doctors and 20% off on medicine orders as well. So I'm seeing that a lot of people have started to type answers. But yes, let us see who the winners for today are. Once you are selected as a winner, you need to write back to us with your details at marketing@apollo247.com so that the gift credits and the health vouchers will be shared with you. So let's see who the winners are. By the way, next week, we need to mention this as well, that Apollo 24/7 is also available on WhatsApp. 09355247247. ये number save कर लीजिए. To avail healthcare services, you can just text or call. Apollo 24/7 is also on WhatsApp. Next week, by the way, we are doing an interesting subject. The next week topic is bleeding gums. जो मसूड़ों में आपको bleeding होता है, what is the cause, treatment and myths and facts. Let's all talk about it next Sunday, that is 27th August, 11 a.m. That's our next Sunday's topic. And today's winners are Rameshwaran Pillai, Cool Atul 22 and Hardayal Singh. Let me remind you that Mr. Rameshwaran Pillai, Cool Atul 22 and Hardayal Singh, you have to write back to us with all your details to marketing@apollo 24/7 and 247.com, that is, and you will be able to claim your gift vouchers. Thank you all for joining us this Sunday. फिर मिलेंगे next Sunday.